Thank you to my distinguished colleague from Kansas, Vice Chair of our Republican Conference. Thank you for yielding time to discuss this situation that's at hand right now. You know, let's pull that back a little bit. Right now, we're faced with this government shutdown. Right now, millions of Americans are thinking to themselves, what on earth is happening in Washington? There's a shutdown. There's the implementation of Obamacare exchanges that took place starting yesterday. You know, the interesting thing is 47 states are receiving frequent error messages on the website. In my home state of North Carolina, the Obama navigators were grounded as the exchange and the computer system was shut down. Americans across this country are faced with error messages on both exchanges run by the state and those run by the federal government. Day one, day two, failure of Obamacare. So despite 3 years of time, countless dollars, countless administration officials testifying, hearing after hearing after hearing in the Energy and Commerce Committee, in the Ways and Means Committee, that everything would be ready to go on October 1st, for sure, right on track. Those were the things that we were told. We are moving right on track. Consistently, we were told. This is what the people of the country are seeing. This is what we're seeing in North Carolina. This is day two of Obamacare exchanges. They changed up a little bit from day one. They added some cute little icons here, and it says, we have a lot of visitors on the site right now. Please stay on this page, as if you have nothing else to do. Just hang out. Just stay here. You know, we checked this site throughout the day, just about every hour, to just check and see if it would be up and running. And it goes on. It says, we're working to make the experience better. And we don't want you to lose your place in line. We'll send you to the login page as soon as we can. Thank you for your patience. Well, yes, America is going to need a lot of patience with Obamacare. Because if this terrible law, and yes, it is law, but there are bad laws that get passed, if this law is fully implemented, health care will be changed forever. You will have to have a lot of patience because you're going to be waiting at the doctor, if you can even find a doctor to go to. You will be waiting at the hospital, in the emergency room, or wherever you seek care, because the care will not be available, and the care that you will receive will be diminished. Yeah, we're all going to have a lot of patience. You know, one of the things that I've been doing in my office is trying to get firsthand accounts of what my constituents are experiencing as they're learning about their health care coverage. If they have health care coverage right now, what is happening to them? And I'd like to share a few of those with you. A nice lady by the name of Judy emailed me and saying she received a letter from Blue Cross and Blue Shield stating that the plan she currently has would no longer be available. Now, if you can flash back a couple of years ago, our president, President Obama, said repeatedly, you will be able to keep the health care that you have. You will be able to keep the doctor that you have. Well, our worst fears are once again realized. Judy has had a change, and she didn't choose it. Someone else did. And it goes on to say that a new plan was chosen for her, where her premiums will go up from $151 a month to $589 a month. My question is, chosen by whom? It certainly wasn't Judy that chose that. It was someone else. It was Blue Cross and Blue Shield. Somewhere along the way, someone else dictated to Judy what she would be able to have. The reason she was given, and this actually was stated in the letter, while rates often change due to rising costs of health care, the new rules and regulations of the ACA, effective January 1st, 2014, contributed to the majority of the increase. It literally stated in the letter that the reason her premiums were going up so significantly was because of the implementation of the Affordable Care Act. Another constituent wrote, "Our self-employed son's insurance went up from $430 a month to $900 a month. That's almost doubled. That's almost 100% increase. We were promised lower costs and more competition. President Obama said our premiums would be decreased by $2,500. Yet I am hearing the opposite from my constituents." You know, one of the other issues that's happening in North Carolina right now has to do, again, with the exchanges. One of the things that we found out about a week ago was that the number of insurance companies that were going to be offering plans on the exchange, two insurance companies are offering plans. There are 100 counties in North Carolina. One insurance company has a monopoly, essentially. They can offer plans throughout North Carolina. And in 61 of those counties, they have a monopoly. They're the only plan being offered. They're the only insurance company being offered. Now, to that they counter by saying, well, we're offering multiple plans. But that's not competition. Competition is amongst the insurance companies that should be provided. We were promised lower rates. You receive lower rates with competition. Very simple, very simple. So only 2 insurance companies providing health care coverage on the exchanges in North Carolina. One has a monopoly throughout. The other covering 39 counties, so you can see 61 counties having a monopoly. That's not fair. How is that fair? As my colleagues and I have been saying over and over again, this law is not ready for prime time, and it never will be. That's the sad part. It is never going to measure up to what we were promised. Even as changes have been made to it, it still is lacking. It's filled with tax increases. It's filled with mandates. This isn't the plan that we should be following for health care. You know, I'm a nurse. I dedicated my life to health care. I came here to Washington to fight Obamacare. I had never wanted to run for office before. But in summer of 2009, when the president was on the road telling us all about the health care plan that he wanted for America, my husband and I, my husband's a general surgeon. We practice in our small town. We said we've got to go out and we've got to speak on this, because one of the things that the president also said was that overwhelmingly doctors and nurses were in favor of this plan. We said, no, Mr. President, that is not true. And we started speaking out against it. The same issues that I was raising with the people of North Carolina that I was speaking to back then are the fears and the realities that we're faced with now. The cost, the overreach, the inefficiency, all affecting health care, all affecting our economy. The workforce alone, as we know, the workforce is going to be changed from a 40-hour work week to a 30-hour work week. We're going to become a part-time America. That's not what our country was built on. And yet that's what we're faced with implementation of Obamacare. That's why we've asked for a delay. That's why we believe that every individual, every American should be receiving the same options that big business has gotten, 1,500 plus waivers given. Every American should be able to say, you know what, I think it's a good idea and I'll take it, or no, I don't. Why should we not have that choice? Why should every American not have that choice? We need to delay it, but more importantly, we need to put a better system in place. And the system that I support, at least at this point, is the Republican Study Committee plan for health care reform. It's an alternative plan that we rolled out a couple of weeks ago. It puts in place all of the pieces that we know, one, that the American people want, that the American people feel they need, but at the same time it puts forward flexibility, affordability, it's patient-centered, it's not government-run. They're the reforms that have been necessary, complete with tort reform, liability reform. That is such an essential piece. Healthcare savings plans, tax credits for individuals who are buying healthcare insurance. It is the answer to healthcare reform. You should be able to purchase insurance across state lines. You shouldn't have to be told that there are only 2 insurance companies that you can choose from. These are the solutions to health care that we really should be looking for. Not given something, not told you have to have something, not told that you will be penalized if you do not participate. The whole point of an online marketplace was to provide options, but as we are seeing, this couldn't be farther from the truth. And I say to my colleagues, thank you to my colleague from Kansas for allowing me to speak my mind on this issue. So important to America, so important to these times with this government shutdown. Thank you.
Thank you, Congresswoman Ellmers.